Hello, my name is Sohaila Rostami. I'm an oculofacial plastic surgeon, double board certified. Today I want to talk about fillers in the face and why sometimes the fillers can give you the appearance that you are overfilled or is not done right. The fillers should never show that you ever have had anything done. It just should refresh your face. That's about it. If they are changing the appearance of your face, it's really not done appropriately. And the way we think about aesthetic, you have to think about logical appearance of aging that we are repairing. So, there are different types of fillers. We have volumizers that give you volume for patients that have lost a lot of weight. And these days we have those patients, especially with GLP-1 agonist products that they are on, like semaglutide, which Ozempic is one of the examples of it. So they lose a lot of volume in their face. So if you correct that in one setting, they're gonna look weird. So it's a step-by-step process. And one of the products that I really care for is Sculptra. Sculptra is a biostimulating volumizer product. It cannot be used everywhere in the face. At the same time, yes, it can give you the volume that you have lost in your face. So a lot of hype is on the internet, and patients come in, they say that, can I get a Sculptra for under my eyes? I'm like, no, you cannot get a Sculptra for under eye correction. You cannot get a Sculptra in your lips. No, you cannot get a Sculptra for your nasolabial fold. So the usage of a Sculptra is for volumizing your face, and it's over time. I prefer, and I don't care what the other people say and do. I've been using a Sculptra, I believe, from the day that was available. I didn't like the way they were doing it in US, so I followed the recommendation of Europeans, and I followed the European guidelines. There were a lot of massaging and those kind, but it was a lot related to the dilution. So I used to do a lot of more dilution that they was recommended at the beginning. And now we know that that's the way it should be. It should be diluted much more than the primary thoughts in US. So I have had my own experience with a Sculptra, and I don't do it all at once. I break it to multiple sessions. They have to come in every 2 months for me to see how they look, and I don't overfill them. I think that over a year or so, their face will change. And it's been proven to me over and over that if you overfill them, they're gonna get even fuller later on. So it's so important to undercorrect and not overcorrect the patient. And then in a year, you will see that they do get to the level that is the best results. So you have to combine the Sculptra with other fillers. So that's not the final results. So you have to do tear trough changes with it. You have to do nasolabial fold with it. You have to do lip fillers. So there are so many things that goes into correcting the volume lost in the face. So it's not a simple thing. It's a very complex situation, and the person has to be very experienced with that product to be able to do a good job for the individual. So they should have that experience behind themselves to be able to offer you the best resolution for the weight loss volume in your face. I really don't believe just addressing the nasolabial fold is the way to go. You really have to assess and analyze the full face, and you have to direct the volume loss that causes the nasolabial fold. Nasolabial fold, even babies have them. So that's not the problem. You have to see what causes the dislike of the nasolabial fold and then address that problem. Lips are very important. Overfilling them make the face look very unusual. Overfilling the cheeks are also very typical of overfilling of the face. Unfortunately, a lot of novices think that they have to putting the fillers here and here, and that's what they continue doing. And I see that this is for not knowing the anatomy of a full face aging, and they're addressing the only things that they have been taught. So it's very important to continue education, learn more and build on your knowledge, and address the full facial aging and avoid overfilling the individual or just direct one area of the face. The whole face needs rejuvenation, and believe it or not, I really believe in the fillers. They really amazing tool in our hand for cosmetic improvement of the face, male or female. I don't care, you can direct it toward a male face or female face. Now, I also have an issue with overfilling the lower part of the face. Fillers are not very good for lower part of the face. Lower part of the face, nearly in every situation, if you have the laxity, the surgery is the answer. A lot of, unfortunately, my dermatology colleagues, and I don't mean in any way to, I think that they are the best. I love my dermatology friends, and I think they're way ahead of me in talking about the skin problems, but because they're not offering anything in the neck, if they're not doing surgical procedures, they overfill the lower part of the face, or the individuals that are injectors that they don't have any other tool to offer the individual. And this part really needs, if you have jawline, if you really have marionette, you have to start thinking about surgical options. Otherwise, overfilling this area will definitely give you the unusual look. So for every patient that tries to improve their aging faces and loss of volume after weight loss, you really have to think about what's happening in your neck and lower part of your face, 1/3 of the face, lower part of the face, and you have to think about surgical options. I hope these clarify some mistakes or some issues that many of us think, and clarify some of those misunderstandings. Thank you.